Hello, PsychU community, and welcome to today's webinar, Health Plan Innovations in Population Health Management for Complex Consumers. Thank you for joining us today. I am Brian Dickinson, a consultant for Open Minds. I'll be serving as the moderator and presenter for today's exciting discussion featuring Deb Adler and Paul Duck. Before we begin our formal presentation, I'd like to take a moment to review our objectives. Today, we'll identify trends and shifts in the market, impacts on health plan management, highlight shifts in provider organizations, and understand payer approaches to addressing complex populations, improving quality outcomes, and achieving healthcare savings. And now I will hand the presentation off to Paul Duck.
So the use of tech tools for consumer engagement, we see is only increasing here. You could see that the adoption of online consumer health engagement tools moving from 21 to 35% in, again, only 2 years. I mean, that's a pretty big swing for this type of adoption. Mobile apps on the right side, show the move from 9 to 39% between 2017 and 2019. Again, a very significant swing. And again, if you look at just mobile apps in general, you'll see more and more focused at mobile applications, only because of the fact that that's a lot of how people are, consuming information today, and they're using mobile devices much more in some cases for health management. And again, there's a lot of device orientation that takes place around the mobile apps. So again, I see this as a escalation in terms of what you should expect to see in the coming years. So I think the reasons why the health plans are implementing these tools is obviously to get consumers engaged in their own treatment, but also to provide information, again, that the health plan selects, and it pushes that information down to the consumer rather than letting Dr. Google do that. So again, having the right information, being selective about that information, and being able to present that information to the consumer is vital in terms of their overall success in treatment in many cases. But in behavioral health, it's not only engaging the consumer, it's also engaging their support system, their family, friends, and others that are involved in their care. Again, depending on the levels of acuity and living situations, that we know can have a significant impact on care, and of course the social determinants of health. But all of those are kind of related, and again, to the degree that we can engage them with technology, and the health plans certainly see that the benefit is there. And again, I only expect to see these continue to increase exponentially. So again, here we're going to look at the use of alternative reimbursement. So fee-for-service and pay-for-performance incentives, again, are focused at achieving quality or cost targets. And again, you can see an increase in those. Here we see an 86% of all health plans had some sort of incentive-based program in place in 2017, which may actually surprise some. But now we're seeing that the adoption of that is at 93% for those kinds of incentives. But also on the right side, you see the use of bundled payments or case rates increasing by 20% between 2017 and 2019. But again, a couple of examples of alternate payment, or alternative reimbursement that's being put in place. And again, this is all kind of a precursor to the move to population health and risk-taking in terms of the provision of care. But ultimately, our industry, will participate in assuming full risk for population health. So let me be real clear up front. And again, a lot of people have different opinions on the time frame for that to happen. But nevertheless, I think you have pretty universal agreement, except for those that really kind of deny that, value-based reimbursement's even taking place and population health is being taken place. But setting those folks aside, what we see today are, basically new methods from payers that build towards full risk. So let's talk for a second about shifts in provider organizations. So here we're really talking about, so how do provider organizations develop services and methodologies, to work with health plans in a population health model? First, we'll start with treatment and program innovations. Here you see in 2019, Open Minds did a study. You see various usages of treatment and program innovations being used kind of across the board. The most popular and arguably the most proven and accepted are peer supports. And again, you could see the adoption there at 54%. And you have 50% offering telepsychiatry. And then if you slide down the chart a little further, you see MAT for addictions, medication adherence technologies, readmission prevention programs. They're all playing a part in the growth of specialty provider organizations. And again, I only see this trend in terms of the growth in these specialty provider organizations growing in the coming years. But again, to have other types of treatment modalities and programs that are added to this list in the coming years, I think you will see significant innovation happen. And again, all of these are around the idea of having proven benefit. So there will be a lot of probably not proven or the programs that are sound to be tremendously innovative, or I'll put that in the category of too good to be true. But again, I think from the reality is if you look at all of these kind of across the board, all of them have shown tremendous value in terms of developing these specialty provider organizations over the course of time here. And certainly we see the adoption of that in 2019. So we're looking at 69% of provider organizations are participating in some form of value-based reimbursement or pay-for-performance arrangement. So there's still provider organizations, of course, waiting for this value-based reimbursement thing or population health to go away. But it's not going away. The reality is that the train's already left the station and it's already running fast and on track, to say the least. So my belief is that our industry will be completely under a value-based reimbursement methodology in the coming 5 years. And I think if you look at the final part of the healthcare ecosystem, I think that will cause the entire system to finally flip is Medicaid's conversion to a value-based reimbursement model. And again, that's a pretty daunting sized pair to convert, but nevertheless, it's one that I think will be the kind of final cog of the wheel, so to speak, in terms of making that happen. But again, I think once Medicaid flips entirely to a value-based reimbursement, fee-for-service will no longer exist as we know it. The idea of paying for volume, which is fee-for-service, will be gone, in favor of paying for value, which is, again, the right outcomes over cost. A lot of people have talked about outcomes over cost is really what equates value in healthcare, but I like adding the word right outcomes, because there's a lot of outcomes that are, you kind of scratch your head, but the right outcomes over cost really is what we comprehend today, I think, as an industry as value. The next slide looks at the proportion of revenues from value-based reimbursement or pay-for-performance contract. And again, you see how this is has a lot of variance to it. So you see various levels of service that fall under health and human services with respect to the percentages and proportion of revenue that's derived from value-based reimbursement. So you can see that primary care certainly leads the way, but still 43% of all behavioral health organizations have up to 20% of their revenue today dependent on a value-based reimbursement. So children's services, IDD, LTSS, a little bit behind behavioral health, but nevertheless, the proportion of dependence on value-based reimbursement is only increasing. And again, I think you can expect those numbers to be jumping significantly in the coming years. It will be interesting to me to see these numbers in a year over year. And again, I think looking at it next year at the same time, towards the end of the year, I think we're going to see a net increase in dependence on value-based reimbursement and revenue and contracts on the rise through all of these types of contracts for these types of services. Here we see the distribution of value-based reimbursement models, and it is something that's changing. So this slide is showing, I think, very clearly a percentage of provider organizations that are participating in some form of an alternative payment model. So we see that 45% of all providers are in some sort of pay-for-performance arrangements with some health plans. So, and again, 30% are under some sort of capitation for a population and very specific services. 23% are capitated for doing some care coordination. that we talked about earlier, and 21% in some form of a case rate or bundle payment. So again, from a timeline standpoint, these models have increased, and they will continue to increase in the coming years. So again, the number of provider organizations participating, I think, in these types of models is only going to increase, and certainly has been increasing. So again, it's all a precursor to risk contracting. And again, I think it's an important tenet to realize, is that risk contracting for services within a population, or ultimately full risk for all aspects of health as part of risk taking or risk sharing in a regional care ecosystem, is all part of this, of what this is preparing. So the future in the shift to risk and population health, I think, is coming very, very fast. I think healthcare on the medical side has really experienced probably much more of exponential growth in terms of value-based reimbursement and population health than we've seen in behavioral health. But nevertheless, behavioral health plays a very key role in terms of, again, bending that cost curve and increasing the overall. If we look at the comorbid population, for example, it's a very important aspect of where some of the cost burden is to the system. But again, part of this, again, is understanding it at a much more granular level than we ever have previously. But the healthcare economy, again, I think has to change, and I don't think too many people would disagree that population health is imminent. And the levels of, I think, innovations from health plans and providers will only increase. So, if you are a health plan or a provider, again, your ability to innovate will be an important aspect of your success in the coming years. So again, I believe that we will see technology playing a very key role in these innovations, way beyond the EHR, electronic health record. But again, technology, I think, that extends to the service delivery and way beyond what we've had in place, traditionally in the market, with some adoption of technology playing a major role in that shift to population health, whether that's telehealth or texting-based metaphor, or whether it's an app that basically reduces some of the need for services. There's a lot of things kind of in the innovation corner right now that I think we'll continue to see some of those. But I think in the most important thing to realize is those organizations that have the ability and a desire and are innovating, will be the winner kind of in the new along the lines of this new healthcare ecosystem. And of course, I think at the end of the day, the big winners, of course, are the consumers. So Deb Adler is going to speak to some, I think, really great case study examples of innovations and methodologies that demonstrate, some of the shifts that I've talked about towards population health. So I'm very excited to have Deb talk about some of these today. So Deb?
Thanks, Paul. I appreciate it. I'm going to start with really setting a framework and then dive into some examples. In my experience, working at payers and also interviewing payers through what we call our 2019 Trends Guide, which is where a lot of the data came from that Paul presented early on in the presentation. We had the opportunity to survey over 1,200 payers, both national and regional, to get their input on their current focus and what was on the roadmap for future innovations. And I really see 4 strategic approaches to tackling complex consumers that payers are using. First is wraparound services, and I'll use a very broad definition here to include non-traditional services to help sustain the individual and the community. So this might include providing a bike to support transportation for an individual that's a challenge, a social determinant of health challenge getting in the way of accessing care. And it might include incorporating digital tools to help support the member between direct care service visits. So in a little bit, I'll give you some other examples, but many of the payers are definitely focused in this direction. A recent example is United Health Group launched a product called Sanvelo, and it's basically an app that offers CBT and other digital tools to the consumer in between their their virtual appointments with direct services. The second strategy I would say is whole person care, recognizing that many members identified as complex have comorbid medical and behavioral conditions. This approach seeks to offer integrated care that really focuses on addressing untreated behavioral health conditions that may be exacerbating medical conditions and costs. For example, individuals with diabetes have a higher likelihood of comorbid depression, and patients with both diabetes and depression have much higher medical costs. I think a great example is a vendor model that I'll talk about in a little bit. An organization called Able2 has worked with many of the national payers to offer coaching and ongoing support to individuals with comorbid conditions that have had a meaningful impact on both quality outcomes and healthcare cost savings. So more on that in a little bit. The third strategy is focused very much on stabilization and crisis management. Individuals with chronic and complex conditions are going to have a higher need for stabilization and crisis management with a focus on prevention, identifying trigger points and addressing with urgent support and mechanisms to offer rapid stabilization. And I think you heard Paul mention that, ED diversion, emergency department diversion, is of key focus to payers, and they're looking at a variety of methods, both that I would call network-based approaches and vendor-based approaches. So from a vendor standpoint, there are on-call crisis services. Protocol is an example that many payers use to offer urgent access to urgent needs. And then many have developed within their own networks an urgent appointment approach. So in other words, contracting directly with a subset of the network, mostly psychiatrists and other prescribers, to make sure that urgent appointments can be addressed and individuals' needs can be met at the least restrictive level of care. I'm going to give you another example in a few slides from the Visiting Nurses Services of New York, who are also working actively with payers on, I think, some innovative programs to work with complex consumers. And then last but not least, a lot of focus by payers on interventions tied to social determinants of health. Payers are keenly focused on not only collecting data related to social determinants of health, but also identifying interventions. And I think as the providers in the audience, an important way to prepare for this is to begin to look at how you can collect information related to social determinants, housing, transportation needs, food insecurity, and how you can be an important conduit to payers, because the reality is providers are the closest to the consumer and may be in the best position to collect that information and then use it to design interventions to improve quality and reduce costs.